Yeah. Hi, I'm Dr. Michael Taggart with the Kirkland Thyroid Institute. I have over 18 years clinical experience helping people overcome chronic health conditions. In our office, we specialize in a comprehensive approach to evaluation and treatment of chronic thyroid conditions that have not responded to traditional medical care. Now, the reason that we get such good results in our office is that I have advanced training in functional neurology, functional neurophysiology, and functional endocrinology. So it is just with this training and the advanced testing that we do that we'll be able to find the exact cause and nature of your thyroid disorder and set up a corrective course to help you get better. And also to help you understand why you have not responded to previous attempts to get better. Now, what we're going to do today is we're going to talk about the number 2 secret to helping you overcome your chronic thyroid condition. Now, this number 2 secret is one of the most important concepts that I'll be sharing through this series of DVDs that we'll be doing. And the concept for secret number 2 has to do with what we call autoimmune thyroid. Now, autoimmune thyroid is actually the cause of 70% of all chronic thyroid conditions. So a lot of people have it. Unfortunately, a lot of people don't know that they have it because proper testing is not done to determine that this is what's going on. So when we use the term autoimmune, what does that mean? Well, what it really means is that your body or your immune system actually thinks that your thyroid gland is an invader and it's actually making antibodies, and certain immune cells are actually attacking and trying to destroy your thyroid gland. As you would imagine, this is not a good thing, and it's something that needs to be handled as soon as possible, because what can happen if it goes on for many, many years, it can get to the point where your thyroid gland can become completely non-functional. So it's something that you want to investigate if you think you have this right away. And keep in mind, 70% of people who have a chronic thyroid have this problem. Now, the good news is that we know how to address it. Now, if you have autoimmune thyroid, what can happen is that your body may create a situation where you get low thyroid symptoms, or you can also have high thyroid symptoms. Low thyroid symptoms would be like fatigue, cold hands, cold feet, hands falling out. You may have pain in your body, you may get headaches. These are typical low thyroid symptoms. Now, you can also get high thyroid symptoms. High thyroid would be like anxiety, trembling, nervousness. And so what happens is that when the immune system is attacking the thyroid gland, it goes in waves. It attacks it. You typically get high thyroid symptoms, and then it will also, the immune attack will decrease, and you get low thyroid symptoms. Now, when you have autoimmune thyroid problems, there's a name that we use to describe it. It's called Hashimoto's. You may have heard that term. And that's typically when you'll typically have high and low symptoms, but sometimes you'll just have low thyroid symptoms. So it kind of depends. But if you have both low and high thyroid symptoms, you probably have Hashimoto's, and there's specific things that need to be done to test to see if you have it. Now, if you have autoimmune thyroid, which is only high symptoms, that's called Graves' disease. Now, how would you know if you have autoimmune thyroid? Well, there's specific blood tests that can be done to help you determine. So there's antibodies that your body will make against the thyroid gland, and they're called TPO and TPA thyroid antibodies. Oftentimes they're not checked, unfortunately, and that if you have that, that shows up on your blood test, then you definitely have an autoimmune condition. Now, unfortunately, sometimes they won't show up. Reason being is that there's certain triggers that will trigger your immune system to start attacking your thyroid gland, and it goes in waves. So if you have the blood test when your immune system is relatively calmed down, those antibodies might not show up. So in our office, we not only check for the antibodies, but we also do some more advanced testing for the immune system to see if there's a shift in the immune system. So in the immune system, you have what's called Th1 pathways and Th2 pathways. Th1 are the cells that kill things, and Th2 are the cells that actually put a tag on something to be killed. So if you have an imbalance in your immune system, what will happen is that these cells may go after healthy tissue or normal tissue like your thyroid gland. So that would be a Th1 dominance. There's specific tests that we do to find out if that's happening. Now, if the antibodies side of your immune system is overactive, it'll make antibodies or put tags on things to be killed that shouldn't have a tag on it. So that would be an overactive Th2. So the test that we do will determine if you have a Th1 or a Th2 dominance. Now, this is a very important distinction here. When you have an autoimmune thyroid problem, the problem is not your thyroid gland, it's the immune system. So if you do things to address Like with hormone replacement therapy, it's not going to work. It has no chance of working. You have to adjust the immune system, and that's specifically what we do in our office. Now, if this information is new to you and you think you have this, which if you've had it for a long time, there's a good chance that you do, and your doctor has not done this testing, or the doctor has done the testing and doesn't know what to do about it, then you need to get a different doctor. What we're offering in our office is 2 free visits. To come into my office, I'll consult with you, I'll talk about your case, and on a second visit, we'll do an exam on the first visit. On a second visit, we'll set out a corrective course of action of specifically what tests that we need to do and what we specifically need to do to turn this condition around so that you can get your life back, so you can get the energy back in your life, and so that you can feel hopeful about your future again. Now, our office phone number is 425-821-1101. I would highly recommend that you give our office a call. We have a lot of success with thyroid patients, and that's one of the things that we specialize in. So next time we meet, I'm going to talk about the number 3 secret to helping you overcome your chronic thyroid condition. We're going to talk about the triggers that cause your immune system to go haywire, so you won't want to miss that.